Ontario has one of the best healthcare systems in the world. There is no denying that. However, one of the best is not what we're looking for. We're looking for a healthcare system that serves the people of Ontario when they need it and how they need it. Single mothers should not have to wait 4 months to get an MRI to find out whether or not they have MS when their MRI machine's sitting available not 3 blocks for them. We have many of the best systems in the world in Ontario, and we're failing to utilize them, we're failing to copy them, we're failing to move them across the system. Furthermore, Ontario is losing its capacity to take care of people. In 1990, we had 50,000 hospital beds in this province. Today, we have a shade over 30,000. And we've lost 1,000 for every year. Every government since 1990, the NDP, the Progressives, and the Liberals have failed to bring that number back up. As a province, we need doctors and nurses and hospital beds. I keep hearing from my Liberal counterparts that they've opened 18 new hospitals. If they've opened 18 new hospitals and there aren't beds that have staff to take care of them, they've wasted money on 18 new hospitals. It is ridiculous to think that we can spread out our resources and still have not created any new facilities that are usable for the people of Ontario. The Local Health Networks Initiative has a lot of potential. Unfortunately, its implementation has failed. It needs to be ripped down. We need to focus on getting it to bring solutions to users rather than paying administrative costs that are going, well, that frankly are disappearing into thin air. We need to focus on bringing in doctors to where they're needed. We need to focus on making sure that machines we already have are being used to their full capacity, and we need to make sure that people are being seen in a timely fashion. The second thing we have to do, which is critical to our healthcare system, is focus on earlier diagnosis and care. Waiting for a cancer to be a certain size before we operate because that's what it says on paper is not a way to reduce costs, and it's not something anybody should have to live through. The idea that somebody who has a 0.7 millimeter growth doesn't need surgery until it's 0.8 or 0.9 is ludicrous, inhumane, and frankly, stupid. Doctors should be allowed to make that decision, and they should have the discretion to do what's best for a patient. What we want for our healthcare system is for it to work for every person in Ontario, every person in every riding, and anybody who needs emergency or preventive healthcare. We spend less on preventive healthcare than any province in Canada. We spend less on long-term care than any province in Canada or any state in North America. People are living at home, taking care of seniors, taking care of people with Alzheimer's, and numerous situations. So 81-year-old men should not be put out of their room so that hospitals can meet their numbers, put somebody else in the room, and leave them to get dressed in hallways. These are all things that have happened in the last 2 to 3 months, and they're real stories from real people I've met. Mental health, addiction, and concurrent disorders is a real issue in Ontario, and one that's very seldom spoken of during elections. The truth is, mental health costs companies billions of dollars a year. It costs Ontarians an untold and uncalculated amount greater than that. We need to start educating people, providing earlier diagnostic services, and getting them the treatment they need. We have people on the streets of Ontario. We have people on the streets of Toronto. You walk down the street, you see people on the street, you see youth, you see people suffering. You see people who are suffering from addiction, mental health issues, and are unable to get help. They go to social services, which are being constantly cut. They're referred to places, and they're told, go out, stay out for 10 days, come back when we have space, and then we'll do something. Here's the bottom line on mental health. We need to take care of people. We need to do it because it's the correct thing to do. We need to do it because it's a humane thing to do. And frankly, it's the cost-effective thing to do. Housing somebody living on the street will cost you about $30,000 a year. That same person, when they go into the health or judicial system, will cost $120,000 a year. We need to start taking care of the people of Ontario. The line is for Ontario healthcare to work efficiently, we need to look at the system and make it work. The answer isn't private healthcare dollars. The answer isn't throwing more money at it. The answer is taking the resources we have and making them available to the people who need them when they need them, and making a healthier, happier population by, in this election, consider voting Green, consider sending a message, and consider voting for a party that values practicality and humanity over simple ideology. Thank you.